First of all, thank you so much, Marco and Karsten, for the opportunity to present the work today. So I'm going to present a case report on corpus callosum agenesis. And it was planned as a case study with 5 to 6 young people with corpus callosum agenesis. But as other studies have mentioned, we had the pandemic, and which gave some restrictions. And also I became head of department during the time. So we only have one participant, but we think that's quite interesting and probably may think of a bigger project out of this, which I will tell you more about afterwards when I present it. So I would just also start to give special thanks to Kenneth that kind of gave the opportunity to look at young people with corpus callosum agenesis, because I'm not in the laterality field. I will tell a little bit more about my background, but I learn a lot, and I think this is really interesting in the research I do. So corpus callosum agenesis, you typically see clinically that they have problems regulating behavior, attention, executive functions, and they're often being viewed as having a neurodevelopmental disorder. So they're often being referred to, at least in Norway, to mental health outpatient units. And if you don't do an MRI, you don't know that they lack parts of the whole of their corpus callosum, and they will be often then be diagnosed as having an ADHD or an autism spectrum disorder. And in Norway, like in Bergen, I've been in contact with a patient organization, and they're really grateful that someone is doing research on this group. And because they don't get much help, they have large kind of struggles in their everyday life, also as parents, but they don't get help because the people in the mental health units, they don't have the competence on this, and in the somatic health, they are kind of a seldom diagnosis, and means that people don't have either competence there. So it is a need of doing research. And it is studies on it, and I'm not going to go in through like any specific studies, but I'm just going to give it kind of an overall background. So what you typically can see from the literature is that these young people often have what you say that's low average full scale IQ scores, but you also find there's a huge variability in their cognitive profile. So they can have like then extreme low abilities, but also extreme high abilities. And when you see this kind of variability, that often can point to, do you have some specific cognitive dysfunctions? And the question is that executive functions or attentional control? So it is several people looking at corpus callosum agenesis. So it's a group in Australia, for instance, and many focus on executive functions and attentional control aspect of it. And then you have researcher that is on laterality, and also present here that look more like on laterality and more like with experimental paradigms to better understand the brain functions. So what we would like to do is to combine it, to both like look at it more like clinically, like an executive attention control test we use typically in neuropsychological assessment, but at the same time also take into account like more the laterality focus and the communication between, using tests that we can actually look at more like the communication between the two hemispheres. And when you do test for executive functions and attentional control, you all know that also very often is based on more like motoric functions, motoric speed, coordination, different things. So it may look like they have executive dysfunctions, but it may be something else that they actually are struggling more with. And this is the background for our study. So short, we did an MRI scanning. I have done using T1 images. We used the forced attention, the correct listening task. And I have just decided I'm not going to explain it because I guess most of you know this task quite well, since we are in a group of laterality researchers, and then a neuropsychological test battery. I would just show you first the corpus callosum from a template. And as you can see, Let's see if this, here is the corpus callosum, as you know, and yeah, it is quite apparent there. And then I'm going to show you the young adolescent boy that we have included. And here you see that it seems like he has intact some of the posterior parts of the corpus callosum, but lacks like the anterior parts. And I know that this boy was also referred to the mental health unit, and also it's like looking much like it's typical, like he's having a neurodevelopmental disorder in his everyday life. But he was still, for some reason, referred to MRI and a neuropsychological assessment, which is not part of this study, but probably because even though they've been viewed to have neurodevelopmental disorders, they probably also be something they, clinician not really understanding about them, because they're a little bit different from what you typically would see with ADHD and autism. So he's right-hand dominant. We did hearing test. We showed values with a normal 8 range on both ears. But the decoding listening results, we would have expected right ear dominance, since like Westerhausen and Hugdal previously have found that the thickness and so on of the corpus callosum is correlating with, the thicker it is, with more of a left ear dominance. But what we found was that it was actually, we found that actually in him, he didn't have like what we expected to be right ear dominance, but more like of a left ear dominance. But I seen in literature by Sebastian Ockelberg that actually you seem to have some previous finding that could kind of also be correlating with this. But what we're going to do, because we didn't expect to have this left ear advantage, we're going to test him again on just the decoded listening, just to see if this is a valid finding. And then we come to the neuropsychological assessments. So we did a battery of several tasks. So first of all, we tested for intelligence using the Wechsler, the WISC-5. And what I've done is, so we have used the criterion of like 1.5 standard deviation below the mean to say that he has an impairment. And this is kind of the consensus to use. But if you're more interested, for instance, in neuropsychological assessment of more like how we can adapt surroundings and the functioning, for some people, we sometimes use only 1 standard deviation, but we're going to use 1.5 standard deviation in this case, because we want to look at what is the impairment. Is that executive function, or is it something else that seems to be the problem for him? And as you can see in this figure, that with the stipple line, the stars that are on the left-hand side, that indicates that he's below 1.5 standard deviation. And we can just start off with these WISC results. So first of all, you have verbal IQ, you have fluid reasoning IQ, which is the things that is not tapping into motoric speed and coordination. And you can see that he is within the normal range. But when we started going into visual spatial IQ, which is requiring, have subtests requiring both motoric speed and coordination, we see that then he comes below the 1.5 standard deviation, processing speed the same. And on coding, which is quite demanding in a way, because it's both requiring motoric speed, coordination, and also that you need to be quite like focused at the same time. He actually had an IQ score of 63, which is very low on this one. So he had problems with it, especially with the coding. So what you can see from just looking at the WISC results is that on the subtask, or that is tapping more into requiring motoric speed and coordination, is where you see that he is struggling. Then we did executive function tasks. So we did a DCAFS version. I'm not going to go into the details, but we did the trail making task where you and the Stroop and Wisconsin card sorting test. And we also had a TOA task. I haven't included that. And you can see that is within the normal range. And all of them were within also 1 standard deviation. And the Wisconsin actually did pretty well on, and also the same was for the TOA task. So we didn't find like the executive function task showing that he had dysfunctions. And then we can move on to learning and memory. So on the California Verbal Learning Test, they are being read aloud 16 words, and this has been read, this list 5 times, and each time they're going to repeat as many words as they can remember. And the maximum remembered 7 words, and that's very low. And you can see that on a learning curve. So it actually was 3 standard deviation below the mean for him on this civility learning curve. And for a longer time memory, that means after 20 minutes, he also were below 1.5 standard deviation. So he seems to have problems actually learning new information. And also on very complex figure task. A figure task is where you have a complex figure and is to copy it first, and then they are to draw it without seeing it, to just by the memory recalling it immediately and after 20 minutes again. And what we could see then is that he both struggled with just copying it, but he also didn't recall much of it. But when he could recognize parts of the figure, so it didn't seem like he kind of got some information in. But all in all, it seems like on learning and memory, that shows that he's struggling. And that is quite like easy to imagine that learning and recalling information and so on is requiring coordination between the different hemispheres and could be more affected. And then we use this old Halston-Wrighton task. I don't know if you know them, but they're very good in a way that you can look into laterality. And we did then administrate the finger tapping task, very easy, just pushing the finger. And we did, then you always, the principle for the Halston-Wrighton test is you start with your right hand, the dominant hand, and then you go to the non-dominant. And as you can see on the finger tapping task, he is about the mean. On the left hand is lower, but still within the normal distribution area. But when and this is only tapping into motoric speed. But when you come to the pegs, the group pegboard task, where you put pegs in holes, it's requiring both speed and coordination. You see that on his right hand, he managed within the normal, I mean, quite on average, but on his left hand, he's doing it quite poorly. So from this, you can see that he's struggling more with his left hand, it seems like, than with his right hand. So again, supporting some kind of laterality. And in the end, we did this tactual spatial problem solving task called a tactual performance test. Okay, I'm soon finished. But I just wanted to show you, if I don't know if everyone knows it, because this is you're using in a clinic, so just so you know what I'm talking about. So the person's having blinds for eyes. And they are to put, they're not seeing any of the boards or anything, so they have not seen it. The only thing they could do is just feel it. And these different kind of pieces they're going to put on a board is put in front of them. And they have, first they start with the dominant, then the non-dominant, and then both hands. And this is quite a sensitive task actually for some kind of something with the brain. And we talk about it like kinesthetic, visual spatial, different things you're capturing with it. And if I then go back, you can see that on all of these tasks, he is actually below the 1.5 standard deviation. When you started out with his right hand, he didn't manage to do it within the timeline. On his left hand, he did it 2 standard deviation below. And when he was going to use both, which is requiring coordination, he was 3 standard deviation below the mean. So all in all, this is this case report or this the functioning of this adolescent boy is confirming our kind of thoughts before we started this study that may not be executive functions or attention control per se that is the kind of main problems. It's related to tasks that is requiring coordination, communication between the hemisphere. And I think that this kind of study could combine more like the experimental way of looking at it with a clinical view. And we would like to continue with this and maybe see if we could collect a bigger group of young people with corpus callosum agenesis and compare them not just to neurotypical development, but also to a group where neurodevelopmental disorders like ADHD or autism to see, because I suspect that they are different. For my view, I work on ADHD. We not that very often see this kind of clear laterality and problems like affected by that handedness or something like that. So I think it's a different profile. Yeah. Thank you so much.
Do we have questions or comments? Yeah, should be ready.
Thanks, Lin. That's a great talk. So looking at the part of the corpus callosum that was missing, which was the anterior part, how much do you think that had to do with the symptoms you saw, particularly the motor behavior and the deficits there?
Yeah, you mean like you could think like if it's, you could find a different profile if there was more like, if he's missing more of the posterior part compared to anterior part. I actually don't know that much, but maybe Kenneth has more to say to me than he's rich. I don't know, but probably, I don't know. I actually don't know that well how the fibers are crossing in the corpus callosum. Have you any thoughts about it?
I suspect that might account particularly the difficulty in coordinating the hands. So you said that was 3 standard deviations below, which is a long, long way below. And so that actually struck me as quite a good explanation for it, that they're actually, the anterior sections are connecting the frontal lobes where the motor cortex is. So I reckon that would be it, yeah.
Yeah, I can see that, yeah. Thank you.
Marcus, yeah.
Thanks for your talk. So quite often in people with callosal agenesis, there's obviously massive reorganization of the brain going on. So what do you know about the reorganization in your particular case?
You mean like, I mean, like part of the puberty, like this?
Yeah. So for example, the anterior part of the corpus callosum. So I'm not aware of partial agenesis patients, but for those who have total agenesis, you know, they have these white fiber bundles basically, which stay within one hemisphere. And I was just wondering whether you see any of this in your patient.
I think I mean, we have MRI like data that we can look into, but we haven't done that yet. But would be, I mean, thanks for the tips. Then we can look at that.
And one just quick question: do you have any figures about how many ADHD kids, for example, are likely to have an agenesis? Do you have any percentage?
No, I don't have, but I actually thought it was quite interesting, like because you could kind of imagine that it is then young people, maybe also people in general with ADHD autism that may have corpus callosum agenesis, because it needs to be, you need an MRI to see it. So, but I don't know. Yeah.
Thank you very much then, Lin. Thanks again.